Okay, let's get started. Maybe we can go over this week's material a bit, and we'll go over last week's quiz questions as well. My name is Ashwant, and I'm one of the PMRF TAs for this course. If you can confirm if you can see my screen as well, that will be great. Can you see my screen? Ah, okay, you can. Perfect. Okay, so let's go ahead. So this week you would have learned a few properties of polymers. One of them being crystallinity, which is when a polymer is slowly cooled from a melting state, it can form these very nice ordered structures, right? So some polymers, not all polymers, such polymers are called the crystalline polymers, and based on the crystallinity of the polymer and so on and so forth, you can calculate something called the melt transition temperature or the crystalline melting point of the polymer, which is basically the temperature at which all crystalline regions within a polymer melt. So like I was mentioning, so when you cool down the polymer from a heated state, it will form these nice ordered crystals. But as you keep heating these crystals, at some point this crystallinity will go away and they'll start melting again. So the point where the crystallinity goes away is called the melt transition temperature. And as the degree of crystallinity increases, obviously the TM also increases because the degree of crystallinity is increasing and you'll require more and more heat to melt this polymer. And yeah, I'm going to quickly go over some of this, not spend too much time because you would have spent a lot of time listening to the lectures. So the other morphological property of a polymer is the amorphousness of the polymer, right? So which is basically polymers that do not form crystals. They're not, when you heat them and cool them, they do not form the crystalline structures and crystals that we previously discussed about. All of the polymers that do not form the crystals are called the amorphous polymers, and they're also referred to as glassy polymers. And just like we calculated Tm, here we calculate something called Tg, which is the glass transition temperature, or the temperature at which the polymer undergoes a transition from a hard glassy state to a rubbery state. Yeah. And the way you measure them is through several ways, but differential scaling calorimetry is how you measure this TGTM and several other things. Okay. Uh, And you would have gone through biomedical polymers, synthetic polymers versus natural polymers, advantages and disadvantages of either of them. For example, synthetic polymers, they can be tailored according to the desired properties, but natural polymers, they are basically isolated from plants and organisms, right? So even though modification is difficult, there are some level of modifications that you can do. And the biggest problem with natural polymers is you cannot control different properties of the polymer, and large scale production also is very different. All of these can be overcome by having a synthetic polymer. But synthetic polymers, again, there could be several problems. uh, but yeah, so several natural polymers that are used in biomedical applications. Uh, And what are some of the most desirable properties of a biopolymer? You would have gone through this. So, first of all, a biopolymer has to be non-immunogenic. So, it needs to have a very low inflammatory response and immune triggering. It needs to be non-toxic. So, as you put in, it should not cause cell death and tissue death to the surrounding cells and tissues. And the so, depending on your application, you should be able to tailor some of the properties of the biopolymer, including mechanical, chemical, and electrical properties. And all of this should be able to be scaled up for mass production. That's also an important factor when considering a biopolymer. And you would have discussed about how you would choose a biopolymer. Basically, it's application based, depending on which route of administration you want to go, what level of biocompatibility you're looking at, so on and so forth. Yeah, so you would have talked about biocompatibility. What are host reactions, some of the host reactions to polymers? So there is blood material interactions, protein adsorption, coagulation, platelet adhesion, complement system activation. So your immune system has a complement system, which you might discuss about at a later point. So that gets activated. Leukocytes adhesion and activation. So leukocytes are another component of your immune system. Uh, there could be encapsulation and scar tissue formation at the site of implantation. There could be foreign body reaction, or there could be infection and inflammation. So all of these are some of the key interactions that the biomaterial might undergo once you put it in a human body. Now, biocompatibility is basically minimizing all these interactions. Uh, Yeah, how would you assess the biocompatibility of a polymer? So you do cytotoxicity measurements, in vivo tissue reactions, blood compatibility, and you check for the blood compatibility of the polymers. And how would you improve the biocompatibility of a bio polymer, right? So there are three major or four major ways through which you can do this. Although several new techniques are coming up, so you can do surface modification with compatible polymers. For example, you can coat your biopolymer with PEG, polyethylene glycol. So basically, it prevents interaction of proteins and other cells with your polymer, right? So you can have surface coatings that prevent interactions of your body to the with the biomaterial that you're implanting. You can also do surface modification to reduce protein adsorption. For example, making the surface more hydrophilic and less cationic. You're basically what happens in a protein? So how is a protein structured, right? So in an in vivo setting, or in any setting where the protein is viable for that matter, so the protein is surrounded by a lot of water. So even though protein is made up of several amino acids, they can be hydrophobic and hydrophilic because it is surrounded by aquatic environment. What happens is all the hydrophobic amino acids orient themselves to the inside of the protein, so they form the protein core, and the protein is basically the outside of the protein is basically hydrophilic. So if you make your surface also more hydrophilic, there are hydrophilic repulsions, and there could be basically less surface protein adsorption. On the other hand, if the outside of the protein is was to be hydrophobic, and you also make your biopolymer surface hydrophobic, then there will be energy minimization, right? Because hydrophobic want to minimize water interactions, whereas hydrophilic and hydrophilic want to maximize the water interaction. So two hydrophilic amino acids really don't want to come together because they want to be surrounded by water, whereas two hydrophobic amino acids want to keep coming back together. So that's why this works. And you can also have concurrent release of or delivery of anti-inflammatory agents. You know, inflammation is a big problem when you put a biopolymer in. So what you can do is you can have anti-inflammatory agents that are encapsulated or coated onto your implant or your biopolymer that are slowly releasing and reducing the inflammation. And you can also use alternative routes to avoid systemic toxicity. So if you know that if you're giving something intravenously, it's causing systemic toxicity, liver failure, kidney failure, and all those, you can use alternative routes to avoid that. Okay. Yeah. So polymers in controlled drug release you would have gone over. So non-degradable polymers, degradable polymers, where you'll use them, examples, so on and so forth. Biodegradability. What is biodegradability? There is biodegradation and there's bioerosion. Erosion is basically chipping off layer by layer, and degradation is basically much more of a random process. There is bulk erosion, surface erosion. So bulk erosion is basically the rate of water penetration into the device exceeds the rate at which the polymer is eroded, right? So uh, the polymer is slowly being eroded away, but water is going in faster. So what will happen is it will form all these cracks, and your polymer is basically eroding as a whole. Surface erosion is basically where the rate of water penetration is lower than or slower than the rate of erosion, right? So water is trying to penetrate, but as it's trying to penetrate, the polymer is also eroding very quickly. So basically, only the surface of the polymer will start chipping away. Yeah, so you would have gone over factors influencing hydrolytic bioerosion. If you guys have any doubts or if you want to go over some topic, you just stop me and we'll discuss that. But oxidative biodegradation measuring, how do you measure bioerosion, right? So basically, you take the implant or the biomaterial that you want to check for, you place it in vivo, for example, in rats or mice subcutaneously, and you after a given point of time you take it out and see how much of it is remaining, so that way you know how much of it has gone away. And yeah, so basically that's what you're doing. Biodegradable polymers, you would have gone over several examples. There are polyesters, for example, PLA, PGA, PLGA. PLGA, one of the most commonly used biomaterial that's currently available and FDA approved, right? So yeah, polyanhydrides, uh, synthetic polymers in controlled drug release. You would have gone over sterilization and storage of these biomaterials. How do you, the biggest problem being, how do you sterilize them? Because you can't simply put them in an autoclave and increase the temperature. Because as we have gone over, so as you increase the temperature, they'll start changing their shape, structure, they'll start deforming, right? So you would not want to do that. Just give me 1 minute. Yeah. So you would not want to do that. Uh, yeah. So how do you sterilize them? You do gamma radiation or exposure to some toxic fumes like ethylene oxide, so on and so forth. Depending on what your biomaterial is and how where you want to put it and how much you want to sterilize. Uh, Let me check how much you would have gone through. Let me see. Okay, so reservoir systems is likely very stop. Okay, so there are several commercial therapeutics that you would have looked at. So insulin, interferon, alpha, all of these are biomolecules, uh, basically proteins, and how you can efficiently deliver them, right? So, polymer drug conjugates, so you can have your polymer backbone with your drug covalently linked to them, or where water or enzymes can come and take them off and use them. So these are basically free drug molecules that can go into the bloodstream, and that can be used by your body wherever they are used. You can also have protein polymer conjugates for very large molecules. So if your protein is too big, you can have PEG conjugates that are basically attached to the protein. So several advantages. So it increases solubility in water or the hydrophilicity of the protein. So it dissolves in water much more rapidly, and because you're increasing the size, you're also reducing how much of it is getting filtered out by the kidney, and you're also reducing the accessibility of some of these proteolytic enzymes and antibodies that can attack this protein, like we've discussed. So pegylation of proteins is one of the ways to uh, prevent their degradation. uh, yeah, advantages, limitations, active site protection, biomaterial conjugation. You would have gone through several chemistries. So, EDC coupling, aldehyde with amines, thiol Michael addition. All of these are the chemistries that are involved in conjugating some of these biomolecules with proteins and stuff. Uh, yeah, you would have likely talked about PEG, which is one of the most celebrated molecules in bioengineering. So it is used as a molecular windshield wiper. So basically, PEG is very hydrophilic, highly biocompatible polymer, and it's non-toxic, non-immunogenic to an extent, and can be produced under good manufacturing practices. It is FDA approved. It is soluble in both aqueous and organic solvents, so the chemistries are easy, and in the body also it's soluble and increases the solubility. And PEG also has very interesting structures, right? So it can exist as straight chains, branches, and not sure. Yeah, it can exist as straight chains, branches, basically whatever structure you want. There could be mushroom like pegs. How do I write? Yeah, so there could be mushroom like pegs. There could be diamond like pegs, so on and so straight branches, branches like this, so on and so forth, depending on how you want the structure to be. Okay. That's PEG. There are reports of anti-PEG antibodies, however. So some people do generate anti-PEG antibodies. So as you keep on using PEG, basically they're going to be more and more likely to neutralize them. So accelerated blood clearance, low clinical efficiency, risk of severe reactions, so on and so forth. So not only will subsequent uses of PEG decrease the efficacy of your biomaterial or nanoparticle or whatever you're using, but they could also have risk of severe reactions, so on and so forth. There are several alternatives. So one of the celebrated ones being polyoigma chains. Yeah, you would have gone over diffusion, Fick's law for what is diffusion and how you can calculate how much of things diffuse from one place to the next. And not going to go over all this, but yeah, essentially you would have looked at several systems, with the first one being reservoir system where you have uh, uh, you basically have a drug depot that could be slowly releasing your drug of interest, right? So that will be a reservoir system. Okay, so are you guys comfortable with this week's lectures? Is there some topic that you want to go over, something that you're not very clear about before we jump into the questions? Okay, so if that's the case, we'll look at some of previous year's week two questions, assignment questions, and we'll briefly discuss them. So please feel free to answer on this question. So I'll keep reading the question. So if you know the answer, I'll give some time. So think about it, and you can answer this question. So I'll keep the chat open as well here. So if you guys are don't want to switch on your mics but type, that's also fine. I'll be able to read. I guess I'll be able to read. Okay, so let me close this. So the first question reads, for a given polymer, rank Tg, which is the glass transition temperature that we discussed, Tm, melting point, and Tc, crystallization point, from lowest to highest, which will be basically which is first and which is last. As you keep on increasing temperature, will you hit the Tg first, Tm first, or Tc first? The options read Tg and then Tm and then Tc, Tg first and then Tc and then Tm, Tm first and then Tg, and finally Tc, Tm first, Tc next, and then lastly Tg. So basically you're saying Tm is low, so let's say 100 degrees, Tc is next 150 degrees, and then Tg will be 200 degrees. So that's what I mean by Tm, Tc, Tg. Uh, or is it the case that you'll see Tc first and then Tm, and there's no TG at all? Or is it the case that TG first and TC next, but there is no TM at all? Or is it TC first, TM next, and then finally TG, or TC first, TG next, and finally TM? Any ideas? Okay, so Raunak says TG first, and then TC, and then TM. Okay, yeah, so that's what you said, right? Yeah. So TG first, TC next, and then TM. So once you do the once you measure these readings, so what you'll see is as you keep on increasing the temperature, as you measure the heat flow, the conductivity of the biomaterial that you want. So basically, at the first inflection point, you'll hit the TG, and as you keep on increasing the heat, you'll hit something called TC, and as you keep on increasing the heat, you'll hit something called TM. Okay, so how do you measure this? Any ideas? Like, what is this line that we are seeing? How do you get it? How do you, like, is there any instrument that can be used to measure it? This one, right? So differential scanning calorimetry. So that's the instrument that you can use to measure this. And okay, fine. So you'll use a differential scanning calorimetry to measure this. But adjacent to this, you would have also studied what heat capacity of a system is, right? So what is the heat capacity of a system? Any idea? When I say heat capacity of a system, what do I mean? Okay, so let's look at what. I guess I don't have it. So heat capacity of a system is basically the amount of heat that is needed to raise its temperature. So the system's temperature by 1 degree centigrade. So this is very important. So it's not degrees Fahrenheit. It's not 1 Kelvin. It's 1 degree centigrade. So basically, the heat capacity of a system is the amount of heat needed to raise its temperature by 1 degrees centigrade. It will be same as 1 Kelvin, but definitely not Fahrenheit. So that will be the heat capacity of the system. Is that clear? Okay, perfect. Let's move on. So the next question reads, which of the following statements is not a limitation of polymer drug conjugates? Choose two statements. So two options are correct here, and they're asking which of the following is not a limitation of polymer drug conjugates. So it should be an advantage. Biomolecule can lose activity during conjugation process. Purification of unreacted polymer biomolecules and any reaction products is necessary before in vivo application. Sterilization process now involves polymer stability, can be viewed by regulatory authorities as a new drug entity. Polymer drug conjugates can improve bioavailability of many poorly soluble drugs. If non-biocompatible, they can trigger inflammatory reactions. And polymer drug conjugates can be made targeted for specific applications. So, which of these do you guys think is are not limitations of polymer drug conjugates? 5 and 7. 1, 2, 3, 4, 5. So 6, 7. Yeah. So polymer drug conjugates can improve bioavailability of many poorly soluble drugs. So that's true, and that's definitely not a limitation. It's an advantage. And polymer drug conjugates can be made targeted for specific applications. So that's also true, and that's also an advantage. You're correct. Yeah. Okay. So the next question reads, a gold surface was grafted with a polymer. The ends of this polymer are tagged with four pendant groups, namely group A, B, C, and D. The pendant groups are weak acids. The modified isoelectric point of the entire polymer was calculated to be as follows. So for polymers tagged with gold surface tagged with group A, the PI or the isoelectric point was 4.5. For B, it was 5.5. For C, it was 7.4. And for D, it was 9. These particles are loaded with a positively charged drug on the surface using electrostatic interaction in PBS, pH 7.4. Which of the following will have minimal loading? So, will all these different gold surfaces tagged with different pendant groups have the same loading? Or will A have the minimal loading, B have the minimum loading, C have the minimum loading, or D have the minimum loading? Uh, what do you guys think is the isoelectric? What is an isoelectric point? pH when net charge is 0. Perfect. Yeah. So that's exactly what an isoelectric point is. Uh, so for instance, if I take amino acids, there's Zwitter ions, right? So at neutral conditions, there'll be a net charge of 0. And if there is a net charge of 0, this pH is called the isoelectric point of that particular amino acid. Now, if I reduce the pH below isoelectric point, there will be deprotonation of the carboxylic acid, and there will be a gain of charge, or the amino acid will become positively charged under acidic conditions, and similarly, the amino acid will become basic charge at under negatively charged under basic conditions, because there will be a deprotonation of the ammonia. Okay, so that's isoelectric point. Now what they're saying is a gold surface was grafted with polymer, and the end of this polymer has four groups attached to it. All of these four are weak acids. and once they attached, they basically measured the isoelectric point of the entire polymer. And the entire if group A was attached, the isoelectric point was 4.5. Group B was attached, the isoelectric point was 5.5. Group C was attached, the isoelectric point was 7.4, and Group D had an isoelectric point of 9. Now, a drug which is positively charged has to be loaded onto these particles. Now they're using PBS to load because the drug is dissolved in PBS, and PBS has a pH of 7.4. They're asking which will have the minimum loading. Is it the case that all of them will have equal loading, or there are some that will have minimum loading and some that will have maximum loading? What do you guys think? Think about it in terms of isoelectric point and how the pH of the PBS is shifting with respect to the isoelectric point, and how that might influence the charge of the polymer, and how that charge will. Uh, okay, so basically, they wanted to load some drug which was positively charged, and this drug was dissolved in PBS. PBS is phosphate buffered saline. Now, PBS has a pH of 7.4, so it's basically saline which has a pH of 7.4, and this drug, positively charged drug, is dissolved in this 7.4 PBS. Now they're asking how, if I have to take this polymer and put it in this 7.4 PBS. Yeah, so Soumya says 9. Yeah, so basically if you think about it in terms of the PI of the polymer, right? So let's go over it one by one. So A has a PI of 4.5. So uh, A has this value 4.5. Now the pH of PBS is 7.4, 7.4, 7.5, right? So basically what I'm doing is I'm subjecting the polymer to more basic conditions, because 7.5 is greater than 4 or whatever it is. I'm basically deprotonating the ammonium in the pendant chain of A. So the A will have net negative charge of minus some net negative charge in PBS, right? Now, because you want to load a positive particle, positive and negative attract each other, and loading will be more. Similarly for B, because you're increasing the PI of B is 5.5. So 5 at 5.5 pH, B will exist as a neutral ion. Now, if you make the conditions more basic by increasing the pH to 7.4, it will deprotonate the ammonium, gain a net negative charge, attract the positively charged drug, and loading will be good. And C, 7.4 is the PI. 7.4 is the pH of the PBS as well. So basically it's at its pH, so it will be neutrally charged. So neutral, there's not much attraction or repulsion between positively charged and neutral particles. But D has a PI of 9. Now basically what you're doing is, this value for D is 9. So if you're taking D and putting it in PBS 7.4 pH, you're reducing the pH or making it more acidic. So what will happen? There will be deprotonation of carboxylic acid. So NH2 will gain a net positive charge. It will get protonated, and there's a net positive charge. Now, if D is getting positively charged in PBS, uh, it's going to have electrostatic repulsions with this positively charged drug, right? Because positive and positive repel each other. So D will have the least amount of loading. Does that make it clear? Yeah, Soumya is right in saying D will have the least amount of loading. If no questions, we'll move on. Which of the following are correct with respect to PLGA particles? Two options are correct here. They're asking which of the following statement is true about PLGA particles. It is a non-biodegradable polymer. It can be used as a vehicle in gene therapy. They can degrade at gastric pH. They have not been used clinically. It is not a copolymer. They can be extracted from chitosan based products. What do you guys think is uh, true about PLGA in these few statements? Is it non-biodegradable? Okay. Round says 2 and 3. It can be used as a vehicle in gene therapy and they can degrade at gastric pH. Any other differing views? Yeah, so basically, you're correct. They can be used as vehicles in gene therapy and they can degrade at gastric pHs. And why can they degrade at gastric pHs? Any idea? No, we don't have the structure of PLGA here, but uh, that's okay. So basically, the hydrolysis of PLGA is catalyzed by both acids and bases. So if you have acidic or basic environment, it's going to degrade faster. And because gastric pH is acidic, it's going to degrade faster. Okay, moving on. What are the advantages of using polyethylene glycol in drug delivery application? Two options are correct here. Uh, PEG has well-developed conjugation chemistries. It is non-toxic, immunogenic, and can be produced under GMP, which is good manufacturing practice. It is highly hydrophobic and biocompatible, can be easily phagocytosed by the immune cells, and or can it deliver cargo intracellularly very efficiently. So, what are the main advantages of using PEG? Soumya says 1 and 2. Any differing views? 2 and 3. Okay, interesting. Okay, so let's go over, since both of you agree on 2, let's discuss 1 and 2, 1 and 3. Okay, so 1, it has very well developed conjugation chemistries, which is true. So if you look at the PEG chemistries, we have discussed several addition reactions, so on and so forth, right? So you can basically stitch PEG to anything you want. So yeah, so we know a lot of how to conjugate PEG chemically. We know how to conjugate PEG photolytically and enzymatically as well. And the conjugation chemistries are immense with PEG. So 1 is correct. Now 3 is wrong because PEG is not hydrophobic. It's hydrophilic. So that's also one of the main reasons you want to coat PEG, right? So it is a highly hydrophilic molecule. So it increases solubility due to PEG hydrophilicity. It increases protein solubility due to PEG hydrophilicity, but it by itself is also, if I can find the PEG page, yeah. So yeah, there are several PEG conjugation chemistries, but it is soluble in aqueous solution, so it is very hydrophilic. So very hydrophilic molecule. So it's not hydrophobic at all. So that's why three is wrong, but two is correct, and one is also correct. Okay, moving on. So okay, little bit of a numerical question. So if a particle takes time t to diffuse L millimeters, how long will it take to diffuse 4L millimeters? Any idea? So some particle is taking time t to diffuse L millimeters. So it's taking time t to travel L millimeters in distance. How long will it, or not travel, I shouldn't say, but diffuse? How long will it take to diffuse 4 times L, or 4 times the distance? I'll give you guys some time to think about this. Option one, 2, 3, 4. So you're saying 16 times the time it took to diffuse L millimeters. Okay. Any other differing views? Everyone agrees with this particle. It took t minutes to diffuse L millimeters, but it will take 16 times t minutes to diffuse just 4 L millimeters. Is that fair? 16t. Yeah. So, okay. You're saying 2t. Uh, can you briefly explain how? Or let's discuss. So, it's not 2t, it's 16t, because if you look at the Fick's law of diffusion, you'll basically find that this should be, it's not L2, it's L squared. So it should be like this, or this. Yeah, so Fick's law basically tells you the time it takes to diffuse, the time a particle takes to diffuse is directly proportional to the length it's diffusing squared. So if you look at it from the Fick's law of diffusion standpoint, what you'll see is, so if it takes t time to diffuse L millimeters, for 4 times L, so that's 4 times L squared. So 16 L, 16, 4 squared is 16, right? So 4 fours are 6. Uh, yeah, just give me 1 minute. Hello. Hello. Hi. Yeah. So sorry. Uh, yeah. So the time it takes for a particle to travel any distance is directly proportional to the distance itself squared. So since you're increasing the distance four times, you square it and take the ratios, and you get the time it takes for the particle to travel, which will be equal to 16 times the time it took to travel L millimeters. Okay. Uh, moving on. Okay, one more numerical. Uh, Consider that a drug A is loaded into two separate reservoirs whose drug releasing areas in the ratio of 2 is to 1 and drug and loading concentration of the drugs are in the ratio of 1 is to 2. What is the ratio of mass of drug released in the same amount of time for these two reservoirs? Assume that the reservoirs are flat and non-erodible. The drug diffuses through a semi-permeable membrane in both cases. Okay, so you're considering a drug A. It's loaded into two different reservoirs, and if you look at the drug releasing areas of these two different reservoirs, and you take a ratio, the ratios are in the range of 2 is to 1. And if you look at the amount of drug that has been loaded into these reservoirs, they are in the ratio 1 is to 2. So, uh, so if I were to say this, so one reservoir is releasing more drug, but the amount of drug loaded is low. The other reservoir is releasing drug slowly, but the amount of drug loaded is high. Now, what is the ratio of mass of the drug released in the same amount of time for these two reservoirs? So you have two reservoirs. One has low amount of drug that's releasing drug faster. The other one has large amount of drug that's releasing drug slower. Now, in a given time t, how much drug is released by both the systems, or what is the ratio of the drug released by both the systems? I'll give you guys some time to think about this. Okay, Raunak says 1 is to 1. So basically, he's saying both the reservoirs will release the same amount of drug after time t. Or does does everyone agree? Do you guys have a different answer? Okay, so we'll go over the answer and let me know if you guys do not agree. Okay, so we know the ratio of drug releasing areas, right? So let's assume the drug releasing areas of yeah. So let's assume the drug releasing areas of the two reservoirs to be A1 and A2. Now we know this ratio to be 2 is to 1. This we also know the ratio of loading concentrations C1 is to C2, let's assume. So that's 1 is to 2. Now, the rate of drug release is proportional to both the drug concentration as well as the area of the release, right? So, if you look at how much of a drug is going to be released from a reservoir system, it's directly proportional to the drug concentration within the system as well as the total amount of area from which it can get released. And so let's assume the mass of the drug released is m. Sorry, it is directly proportional to the concentration of the drug within the reservoir and the area of the reservoir itself. So concentration times area. Now, so for the first reservoir, the mass of the drug released would be proportional to C1 times A1. So so C1 is the concentration in the first reservoir. A1 is the area, the drug releasing area of reservoir. So C1 times A1 will give you the mass of the drug release from reservoir 1. Same for the second reservoir, C2 times A2. Now what you want to calculate is they're asking for you for the ratio. So ratio is basically C1 times A1, which is the mass of the drug release from reservoir 1, divided by C2 times A2, which is the mass of the drug release from reservoir 2. Now, we know A1 is to A2 is 2 is to 1 and C1 is to C2 is 1 is to 2. So you can just simply substitute the values. So this will become 1 by 2 times 2 by 1 and the answer will be 1 or 1 is to 1. So the same amount of drug will be released from both the systems after time t. Is that clear? Is that clear?
Sir, please can you repeat again?
Yeah, so basically what they're asking is, so they're telling you a few things. So let's consider a drug A. Now you take this drug A, you load it into two different reservoir systems that you have. Now, if you look at the drug releasing area of these reservoir systems, they are in the ratio. So basically the circumference. So assume these reservoirs to be circles or spheres, right? Now you're basically looking at the circumference of the reservoir. They are in the ratio of 2 is to 1. So one reservoir is much bigger than the other one. And if you look at the amount of drug that's loaded into these two reservoirs, that is in the ratio of 1 is to 2. So whichever is the bigger reservoir, it has lesser amount of drug loaded. And whichever is the smaller reservoir, it has double the amount of drug loaded. What they're asking now is the ratio of mass of the drug released in the same amount of time for these two reservoirs. So they're saying, okay, if I let these reservoirs release this drug and for a time t, and if I look at how much of the drug is released, what is the ratio of the drug released by reservoir 1 compared to the reservoir 2? Now, how we calculate that is, so we know a few things. We know the ratio of drug releasing areas or the circumference of both the reservoirs. So, if I assume the reservoir 1 circumference to be A1, reservoir 2 circumference to be A2, I know A1 is to A2 is 2 is to 1, which they have given us. Similarly, we know the drug loading concentrations. So if I assume C1 is the concentration of drug loaded in reservoir 1 with circumference A1 and C2 is the concentration of the drug loaded in reservoir 2 with circumference A2. I know C1 is to C2 is 1 is to 2, which they have given. Now, what I want to calculate is the ratio of the mass of the drug release from both these reservoirs. I know something about the amount of drug released from reservoir systems. What I know is I know the rate of drug released is directly proportional to both the drug concentration as well as the area of release in a reservoir system. So I know mass of drug release is directly proportional to the concentration of the drug in the reservoir system times the area of the reservoir system. Now, for reservoir 1, uh, the mass of the drug release will be proportional to C1 times A1. So concentration is C1 for reservoir 1, and the area is A1 for reservoir 1. Similarly, for the second reservoir, it would be C2 times A2. Now, simply what they are asking you is calculate the ratio of the mass of the drug release. So, ratio will be uh, the amount of the mass of the drug released by reservoir 1, which is C1 times A1, divided by the mass of the drug released by reservoir 2, which is C2 times A2. So, that will give you the ratio. Now, once you write this down, you'll realize that you know something. So, you know C1 by C2 is 1 by 2, and you know A1 by A2 is 2 by 1. So, it's simply 1 by 2 times 2 by 1, which is 1. Is that clear?
Yes, sir.
Okay. Okay. Moving on. So, the next question reads reservoir system refers to what? Is it a system saturated with drug surrounded by degradable membrane? Or are reservoir systems all systems with zero order release rate? Are reservoir systems all systems with first order release rate? Are they systems which are which have a non-degradable membrane and are supersaturated with the drug? Or all systems with second order release rate reservoir systems? Or systems with a semi-permeable membrane which degrades with time reservoir system? So I'm talking about reservoir systems. What are these reservoir systems? Is it a system saturated with drugs surrounded by degradable membrane? System with zero order, all systems with zero order release rate, all systems with first order release rate, all systems with second order release rate. Okay, so a couple of people are saying it's option 4, which is systems which are non-degradable membrane and are supersaturated with the drug. So they have a non-degradable membrane and there's a lot of drug inside. Everyone agrees, or are there any other answers? Okay, looks like everyone is agreeing. So, yeah, you are correct. So, basically, all systems with a non-degradable membrane. So, the membrane cannot degrade in the body. So, it's going to be there, but there's a lot of drug inside. So, the drug will slowly come out either through orifice or through diffusion. There are several ways through which it can come out. You would have discussed in the class. But, yeah, such systems are reservoir systems. Okay, moving on. Which one of the following polymers degrades hydrolytically by near zero order kinetics? Is it polylactides, polyesters, polyanhydrides, polyamino acids, polycarbonates, or polyamides? So they're asking which of these given options degrades hydrolytically with near zero order kinetics. Now, what is zero order kinetics? So can someone define what zero order kinetics is? Okay, you're saying polyanhydrides. Okay. Yeah, but first let's talk about what zero order kinetics is. So, what is zero order kinetics? Elimination does not depend on drug concentration. Yeah, so if you're talking in terms of drug elimination, But generally, whatever the chemical reaction is, it does not depend on the concentration of the substrate. So, in this case, what you're saying is polyanhydrates have a near zero order kinetics. Any idea why? So, first of all, does everyone agree with polyanhydrates being the one that degrades hydrolytically with near zero order kinetics, or do you guys have a different answer? Yeah, so looks like everyone is agreeing, but Raunak is also telling it's because of this COC bond. Uh, yeah, so you are partially correct. So this bond is highly unstable, especially when it comes to uh, weak polar solvents, right? So water is a very water is a polar solvent, and essentially what happens is water is basically H plus and OH minus ions, and H plus ion basically asks like convinces this oxygen to pull this electron towards itself. So this becomes O negative, and this bond becomes very unstable, and it can very easily get cleaved. So this C sort of becomes C positive, and as a result, there's also OH minus, right? So it will come and cleave the bond. Yeah, you're correct. So polyanhydrates are the ones that show zero order degradation, and it's because of their structure, the COC bond that they have, which is very enzyme hydrolytically cleavable because of especially in water because of the polarity of the water. Okay, okay. I think the final question from this week, which is the numerical. So they're asking you to consider a microsphere of diameter 1 micrometer. Now they're asking you to calculate the number of such particles, these 1 micrometer microspheres, that would be present in 1 mg given the density of the material is 1.3 grams per ml. There are two correct answers. I'll give you guys some time to solve this, and we can discuss how to solve this and any questions you guys might have. So there's a microsphere of diameter 1 micrometer. Now they're asking how many of these particles will exist in 1 mg of this weighed material, given the density of the material is 1.3 grams per ml. Okay. Was anyone able to solve? Did you guys understand the question? So very simply, you have some kind of ball. Diameter is 1 micron. Now they're asking you to calculate how many of these balls are present. If you so there's this big bottle of these balls. So you weigh out 1 mg. Now you know the diameter of the ball, each ball to be 1 micron. Now, if you weigh out 1 mg of these balls, how many of these balls are present? Given the density of the density of the balls is 1.3 grams per ml. Okay, so let's discuss the answer. Uh, or does anyone need more time? Can just type in yes in the chat if you need more time. Okay, so let's discuss the answer. So the answer is okay. We'll get to the answer when we'll get to the answer. But okay, just give me 1 minute. You guys can keep solving in the meantime if you guys are trying. Uh, Okay. So I'll tell you guys half the answer. I'm just checking to see if this is this week's question or not. Uh, Not able to, but okay. So I'll tell you guys half the answer. You calculate the rest. Take your own time, but that's okay. So one thing you know is you know the diameter of the microsphere. So you know the radius of the sphere. So you can calculate the volume of the sphere, right? 4 by 3 pi r cube. So because you know it's a sphere, microsphere. Now, how do you calculate the number of microspheres in any given material? So for that, you have to know the mass of how much you're taking, which is they said 1 mg divided by mass of one microsphere. So if you can calculate the mass of one microsphere and you divide the amount that's taken by the mass of one microsphere, you'll know how many microspheres there are. Very easy. Now, what you can calculate is the volume because 4 by 3, you know, the constant, pi, you know, the value of pi, and radius, you know. So, diameter by 2, 1 micron by 2, 0.5 microns. So, now you know the volume of the microsphere, which if you calculate, it will turn out to be this. Now, what else do you know? You know the density. Now, what you can calculate from the density is the mass. So, you know, density is basically mass by volume, right? So, from that, you can calculate mass of one microsphere to be volume of one microsphere times the density of the microsphere. And if you do the calculations, you will get the mass of one microsphere to be 0.681 into 10 power minus 15 grams. Now from here, you can calculate the total number of microspheres. How do you calculate? You know the mass of substance to be 1 mg. You know the mass of microsphere. And you can basically calculate the basically how many microspheres there are in 1 mg of the particle. So yeah, so that's how we solve it. I don't know if this is uh, this week's assignments question. I don't know if you guys know. So not going to discuss much. We can discuss this next week. But so you know the diameter, you know the radius, you know the volume, you know the density, and you can calculate mass of the microsphere, and you can basically divide mass of one microsphere by the mass that you're taking. Okay, any other questions you guys have? Okay, if not, we can end today here. From next week, I think my session will be on Saturday, so I'll see you guys on uh, Saturday, which is on 17th. Okay, and then we can discuss this problem. So I'll try to. So I'm trying to see if I have access to the new course. Yeah. So yes, here mass of the substance is 1 mg. Yes. So this is the mass of how much ever you want. So this 1 mg has a lot of these microspheres. So basically, they're asking you how many microspheres there are. So from this mass, you will have to calculate the mass of an individual, a single microsphere. Because you know the density, you can make that connection. You know the density, you can calculate the volume, so you can make that connection. Okay, if you guys have no other questions, then we can end the session here. Okay, see you guys. Bye.